Hi guys, I'm Dr. Kandi, and of course I had to talk about the hot topic of the last year, vitamin D. It's got everyone talking and speculating, and with 1 in 4 Britons who apparently are deficient in it, I'm not wholly surprised. So in a few minutes, I'm just going to explore all things vitamin D, what it is, what are the benefits, why has it been in the news the last year. Let's have a listen. So one way we get vitamin D is through the sun. That's why we call it the sunshine vitamin, in which UVB rays from sunlight convert the precursor found in the skin into vitamin D3. And the other way is through dietary supplements, which produce predominantly vitamin D2. Now these are both types of vitamin D, but they are useless until our body gets to work. So the precursors pass to the liver, where it picks up molecules, and then this passes to the kidneys, where it picks up more molecules, and this becomes the active form of vitamin D that we're all super excited about. So you definitely need a good functioning liver and kidney in order for this process to happen seamlessly. So vitamin D increases the absorption of calcium in the intestine. So we know that it's really important for bone health and teeth health. And without enough vitamin D, the body can only absorb about 15% of calcium as opposed to 40% when it's operating at adequate levels. So a lack of vitamin D and calcium can lead to things like rickets in children or osteomalacia in adults. And this is where you get soft skull or bowed bones and weaker bones that are more likely to break and fracture. And it can also lead to heart disease and sometimes death. But thankfully, this is relatively rare. Now, scientists later also found that many of the body tissues and organs have lots and lots of vitamin D receptors, which means that its role is way more involved and evolved than we originally thought. Vitamin D has now been found to be really important in regulating cell growth and our immune system. So it prevents overmultiplication of cells, such as in cancer, and it's actually linked to cutting off blood supply and killing cancer cells and thereby stopping its spread, aka metastases. It's also been linked to a reduction in depression symptoms and a reduced risk of type 1 diabetes. So symptoms of vitamin D deficiency would be things like muscle, bone and back pain, fatigue, tiredness, hair loss, frequent or severe bouts of illness, depression and slow wound healing. So people who are at risk are those who don't get adequate exposure to the sun, like us, all year round. And even when the sun is beaming, we're correctly advised to lather up and protect ourselves away to prevent skin cancer and the likes. And then also our diet. Not many foods actually contain large amounts of vitamin D. In fact, many foods have to be fortified, have vitamin D and minerals added to them in order to get good amounts. Things like formula for babies, cereals, yogurts, and actually milk doesn't have that good amounts of vitamin D, contrary to what many people think. And then darker skin people with, high melanin counts, they prevent absorption of vitamin D, and so they're also at risk. Also, the elderly, those people who are in care homes or prisons, are more likely to be at risk of vitamin D deficiency. So vitamin D can be found in some foods like fish, egg yolk, plants and mushrooms, but who's having egg yolk every day? So as I mentioned, there aren't that many food sources that contain vitamin D. If I could think of them, then I know that 1 teaspoon of cod liver oil has the highest recommended amount, so over 2 times the amount than any other source. 85 grams of salmon has about 75% the recommended daily intake, whereas 85 grams of tuna in water has about 1/4 of the recommended daily intake. So when I talk about the recommended daily intake for vitamin D, it was probably roughly, for babies up until about a year old, it's about 400 international units or 10 micrograms. And thereafter, it's roughly about 800 international units. Interestingly, symptoms of a vitamin D overdose or toxicity would be things like confusion, lack of concentration, drowsiness, depression, tummy pain, vomiting, constipation. But I'll be honest, it'd be really hard to overdose on vitamin D, and they have advised that the safest upper limit is probably about 4,000 international units a day. Just a note for my pregnant mums and my new mums, It's important during pregnancy to have vitamin D levels checked and just take your recommended amount. And being careful not to use high doses until at least the second trimester. And then regardless of whether you as mum is supplementing or not, if your baby's breastfed or mixed fed, then they need daily supplements from birth. And because formula milk is fortified with vitamin D, as I mentioned, if they're exclusively formula feeding, they don't need any extra vitamin D unless they're taking less than 500 mils daily. Now, we don't all need to be lining up at the GP to check your vitamin D. If you are otherwise fit and healthy, I think it's enough to just take the recommended amounts every day. If you know someone who is in a care home or shielding, the UK government has just announced in November that they'll be offering 4 months of free supply of vitamin D. You just have to visit the website before the 21st of February 2021. So vitamin D and COVID-19. Now, I'm sorry to disappoint, but honestly, the current evidence is conflicting. Some studies haven't been able to find a cause and effect link between vitamin D levels and getting COVID-19. But other studies have shown that those with deficiency are more likely to test positive for the virus, and people with adequate levels have had a less severe illness and a better survival rate overall. So there are more trials going on as we speak, so I think it's important to just watch this space. The truth is, and my truth is, we may not have concrete evidence, but from what we know about vitamin D's role in immune health and fighting against other illnesses, I would make an educated guess that there is a link. In any case, with really little side effects and a low risk of toxicity, it's readily available, it's cheap, and with a host of other health benefits, why wouldn't you start taking your vitamin D regularly? Thanks for listening. Be sure to follow and subscribe to Life of Dr. Kandi for more, lifestyle tidbits and information to boost your health and overall wellness. Thank you.